Yeah, so there were 6 trials done internationally, one in the United States, 4 in Europe, and 1 in Asia, looking at comparing 3 months of adjuvant therapy for stage 3 colon cancer to 6 months. 6 months is currently the standard. There are really 2 regimens used. One is FOLFOX, 5-FU-glucovorone oxaliplatin. The other is CAPOX, capecitabine and oxaliplatin. And most of the trials had some mix of those. None of the trials randomized between CAPOX and FOLFOX, but most trials had some level of physician or patient choice. And what was presented yesterday at the plenary session was when you pooled all those patients, nearly 13,000 patients, the primary endpoint of the study was disease-free survival and looking at non-inferiority. So the way non-inferiority works is you accept some level of difference that is not clinically meaningful, and if your upper limit of confidence interval of that hazard ratio exceeds that point estimate, then you say it doesn't meet non-inferiority. And when you pooled all 6 trials together, no matter what type of treatment they got, the effort did not show non-inferiority. So the term used is not proven to have non-inferiority. However, there were also pre-planned subsets that were looked at, including whether you got capecitabine oxaliplatin or you got FOLFOX. Lands up if you got capecitabine oxaliplatin, again, not as a randomized effort, but those patients, non-inferiority was reached. And there were also high and low risk subgroups. And so the high risk group are people at T4 tumors all the way through their colon, or N2 tumors, 4 or more positive nodes. Those patients first have a worse prognosis, but there it's a little more suggestive that 6 months of therapy would be important to recommend. And in the lower risk group, 3 months of therapy. 3 months definitely of CAPOX, and even with 3 months of FOLFOX, the difference is really marginal between the 2 arms. So that will be incorporated in people's practices. What really the question is now subsequent clinical trials, how to design them and what's the duration, and they may have to be a little bit more personalized to both risk group and choice of therapies.